right. Well, welcome. Welcome, welcome, welcome. Come on in. I see you're very excited about this particular webinar. And what we typically do in starting our webinars is to ask you to do as you would do if you were face to face. If you were walking in the room, I think you would say hello. You would speak and greet everyone here. And so as you come into this space, we ask that you say hello, greetings in your language, in any language, and also say where you're hailing from today. So we want to hear from you. We want to know, where's everybody joining us from? We know we have a global following of people who share with us every month from all over. We have people who are coming in from South America, from South Africa, from West Africa, from Europe, Eastern Europe, Canada, Australia, New Zealand. We have a community of people from all over. So we want to hear from you to see where you're coming from. So I see some of our favorite people. Hello, Rachel. It's good to see you. It is great. Abiola from the United Kingdom. Yes, thank you so much for staying up to be with us today. Shalom. Yes, absolutely. Shalim, thank you so much. Hailing in from Virginia. We appreciate you. Absolutely. Hello, Dr. Keita from Mali. Absolutely. Exactly, Tina. This is the United Nations virtual. Exactly. We love seeing you. Thank you so much for being with us. It is an interesting day for a lot of people in the United States. I live in the southern part of the United States where it never snows. This is a warm, hot, steamy city that I live in, and we woke up to snow today. So it is a very unusual time for us, but we are very glad to see you. Tomar, thank you for joining us from Harlem, one of my favorite neighborhoods in the world. Absolutely. Thank you so much. Yes, it's snowing in Alabama as well. Exactly. It's a very interesting day. So this is good. Yes, settle in, settle in. I hope you have some water, some tea, some coffee, a snack perhaps. I hope you're in a comfortable place. You're seated or lying down perhaps. Whatever it is that you're doing, get comfortable because this is going to be an excellent, excellent webinar. Today we're talking about partnerships. And those partnerships, we're talking very broadly. So we could talk about agencies partnering and collaborating. We could talk about individuals collaborating, government organizations. Really, this is going to apply to a lot of different settings. And of course, it relates to our work that we do in trying to uplift communities. So we look forward to your comments. We typically have a very lively discussion online here, our virtual discussion. So we look forward to seeing that. So I'm going to start us off because we always start off with our jingle that you helped us to pick. So we will get started with that. And you see these new faces here. We're going to introduce some of our partners to you and remind you of our team. So again, we're going to keep reminding you, new folks who come in to greet us. So I'm going to share my screen and we will get started. Absolutely. Yes, when you hear that clarinet, you know that we are about to begin. We're getting started. So today our topic is the power of partnerships, the CREST program and Global Health Action Partnership. And I think you're really going to love it. We have been blown away ourselves by how amazing this partnership has evolved. And we just couldn't keep it to ourselves. And so we want to share it with everybody and maybe help you to see some of the gems of what we have discovered amongst ourselves. So, for those of you who are new to the CREST program team, I'm Dr. Cirecie West-Olatunji. I have with here my co-founder, Dr. Constance West, our research fellow, Dr. Ebony White. You might have seen her. She just recently facilitated a training. She's going to do more of that this spring around loss and grief. We have Miss Kimberly Bowe, but we're going to fix this. She is now Dr. Kimberly Bowe. Yes, exactly. She has successfully defended her dissertation, and she is now Dr. Bowe. And we're glad she's going to stay on. Our social media intern, Sasha Gabriel, and then Ms. Jonay Bond, our graphic designer, who has been with us since the very beginning. So we definitely want you to know what's available and the resources and so on. And we didn't want to take up a lot of time, so we created this video to just let you know what it is that we do in case you didn't. At the heart of CREST program is decolonized training. This is warranted in education, mental health, medicine, and parenting, to name a few. Whatever the setting, we have all been influenced by the cultural hegemony that permeates our professions. At CREST program, our courses specifically address race-based stress and promote intergenerational resilience. Our videos on demand come in various packages, including full credential programs that replace conventional coursework, individual workshops, and numerous lecture series. We also customize training programs to meet your organization's or group's needs uniquely. Now, we know that some of you are dedicated members of the CREST program community. Isn't it time to acquire some CREST program merch? Check out our online marketplace. In addition to the umbrellas, blankets, and tote bags, we offer resources to apply in your work with Black youth and other children of color. Before we forget, remember to complete the post-webinar survey. Your comments will help us enhance our programming and determine new topics for education and training. Finally, we encourage you to follow us on social media and share our posts within your social network. Thank you for your support. Exactly. So, and just some reminders, of course, our winter newsletter came out. It was published a couple of weeks ago. Check it out. The spring newsletter will come out in March. And we're going to be at the ESEA conference. So those of you who are in education, you might be planning to attend that conference in Austin, Texas. Yeah, of course, donations. We love that. Thank you. And yes, please, thank you to all of you who've completed those post-webinar surveys. We need your feedback to improve what we do, to confirm that some of the things that we're doing are meeting your needs, and then also the suggestions that you have for future webinar topics. Please save the dates. So put it on your calendar so that you tell people, no, I cannot meet with you. I'm going to be at a CREST program webinar, so we hope to see you there. And again, today we're talking about the power of partnerships, the CREST program and Global Health Action Partnership.
So today's learning objectives, we actually have 3 things we want to achieve by the end of today's webinar. The first is we want to help to identify keys to developing and maintaining successful partnerships. So we're going to talk to you about some of the lessons learned and what we felt were unique about this partnership, what it was about GHA and what it was about CREST that made this partnership something that ended up being very fruitful and very promising in terms of our work in the future. Secondly, we'd like to enhance your awareness of the need for a shared vision for culturally driven interventions and service provision. So the key there is having a shared vision across agencies. So in this situation, both agencies, both in terms of the individuals and the actual organizations or companies, are very focused on achieving very similar outcomes. And then last, we want to demonstrate how an effective partnership can be used to deliver interventions, particularly those that are culture centered and trauma informed, can be used to prevent or mitigate the impact of working within traumatized communities. A lot of times, people who have very caring spirits and are very dedicated to making a difference with achieving social justice in communities are prone to being at high risk for burnout, right? And so a lot of times we ourselves are affected by the same situations that we encounter, or just by being exposed to people who are going through such turmoil in their lives that we can start to have some negative outcomes. So we want to be able to talk to you about the importance of working with communities. For those individuals who are working with traumatized communities, to take care of their own health as well.
Thank you. So we've got those three learning objectives for you, and we know that you'll be able to achieve those. Absolutely. So today's panelists, of course, myself, Dr. West, Dr. White, and then we're going to introduce you to Ms. Wendy Jolley-Kabi, Dr. Charsey Cherry, and Dr. Bwalya Mubanga. So let's start. So I'll introduce Wendy. So Wendy is GHA's president and CEO. She's an experienced leader of international health and development organizations, and she has a proven track record in engaging diverse stakeholders and responding to emerging challenges around the globe. She is a graduate in political science and religion. She has her master's from Villanova University. She is a graduate of the Montgomery College Nonprofit Leadership Group. You can see she is a committed leader with a lot of global experience. Perfect person. We've enjoyed working with her.
And I have the honor of introducing Dr. Charsey Cherry. Dr. Charsey Cherry is a member of the GHA team, the Global Health Action Team. He is a community systems strengthening advisor. He is super dedicated, a great person all around. I have to say that I actually have had the honor of working with Dr. Cherry before, and I'm just an amazing person. He is the author of over 70 peer-reviewed articles. He had served in the U.S. Air Force, so he's a veteran. Thank you for your service. And Dr. Cherry is a graduate of the Southern Illinois University and the Rollins School of Public Health here in Atlanta at Emory University, and has his doctorate in public health from the University of South Carolina. So welcome, Dr. Cherry.
And Dr. White, you're introducing Dr. Bwalya Mubanga.
I'm so excited to introduce Dr. Bwalya, who serves as Global Health Action's Monitoring, Evaluation, and Learning Advisor. He has extensive experience operating in various roles within U.S. aid funding projects, including the Director of Monitoring and Evaluation, Government Liaison Officer for U.S. Aid Data Rising Monitoring. Dr. Bwalya has been super integral in our partnership. He always has jewels that I know he'll drop today. He has extensive background in working around HIV, AIDS, STI, part of the national team representing Zambia at the Southern African Development Community. His postgraduate qualification from Stellenbosch University with a minor in monitoring evaluation, but more importantly, he is going to give us some really valuable information today. So thank you, Dr. Bwalya, for joining us.
Very nice. Very, very, very nice. So you can see we have an amazing group. We have an introduction video from GHA that I think you'll enjoy.
Throughout the world, women, children, and teens face sexual violence, unsafe pregnancies, poor health care, and more. At Global Health Action, we're drastically reducing these threats and helping those most impacted to thrive through better health and well-being practices. For more than 50 years, we've produced worldwide health education programs, leadership training, health advocacy campaigns, and more. With our global network of community health agencies, government offices, and nonprofit organizations, we've developed health programs recognized by the Centers for Disease Control and Prevention, the World Health Organization, Ministries of Health, and a range of non-governmental organizations, universities, hospitals, and foundations. To date, we've trained more than 10,000 leaders from 97 countries, which has benefited more than 69 million people. With support from donors like you, we'll continue our mission of advancing global health equity and empowering healthy communities everywhere. Make a difference in the lives of women and children by making a donation to Global Health Action today.
Excellent, excellent. All right. So that is who we have here as our partners. So you hear a little bit about who they are, you know who we are. We'd like to start out with just inquiring from you. We want to hear your voices. What do you want or need most to receive from today's training? So just in the chat, low tech, just put in the chat there. What do you want or need most to receive from today's training? Aha. Okay. Yeah. So funding and the idea of strategic partnership. Great word, strategic. Exactly. Definitely. Yes, exactly. Outreach, creative outreach. Definitely. How do we work together? Wonderful. Yeah, being effective. Exactly. Hmm. And diversity. That's a good point as well. Diversifying. Mm, absolutely. Yeah, we struggle, don't we? We struggle with partnerships. And I think a lot of times we have bad experiences with partnerships. And then that makes us a little hesitant to go into partnerships. We've got a lot of horror stories that we tell about partnerships. Yeah, Mario, exactly. Trying to have long-term partnerships. Yeah, exactly. Hmm. Really, it's difficult. Sustainability is important. Yeah, exactly. Thanks, Keita. Exactly. Yeah, it's true. We also need to find ways to measure the impact of the work that we do and how do we do that together. Yeah, Yvonne, like when we think about what some of the challenges are, we can't ignore that we're living in these very toxic, racist, colonialist environments. And that creeps into our relationships as well, where we have difficulty trusting each other, right? Which is very difficult. And a lot of times in our relationships, maybe they're remote. Maybe we've never really met these people in person, and we've been working digitally to try to establish a common plan or a common mission that you have together. And so it's very difficult to create trust across the ocean, perhaps. So we're really excited about sharing with you here today how we've been able to successfully do that. So I think we're here.
Yes. Thank you, Dr. West-Olatunji. All right. So good afternoon or evening, wherever you are. I'm Dr. Charsey Cherry from Global Health Action, and it is a pleasure to be here with you and have you here with us. So the pictures that you see on the screen in this slide came from our Kenyan implementing partners that we have been working with, GHA has been working with for the last couple of years in our Ripple Effect Local Capacity Building program. And we put these pictures here because this is really how the GHA CREST program partnership began. So what happened was in the spring of 2024, severe floods ravaged parts of Kenya. And they left a trail of destruction across homes, infrastructure, and livelihoods. Now, this devastation hit hardest in remote and isolated communities where access to resources and aid was limited. And in the face of this crisis, grassroots organizations in partnership with Global Health Action, or GHA, through, again, our Ripple Effect local capacity building program, played a crucial role in the emergency response. Local grassroots organizations became really the frontline responders, particularly in hard-to-reach areas. And this was crucial because many of these communities were beyond the immediate reach of both national and international relief efforts. So these local leaders really began to work tirelessly to provide immediate relief, to rebuild, these shattered communities, and to offer hope to those that are affected or were affected. And GHA recognized the urgent need to support both the communities and the leaders who really were beginning to be stretched really thin by their responsibilities. And we collaborated with local organizations to ensure that the response was something that was community-led and culturally grounded. Now, the first step GHA needed to do to get involved was really to listen to the community leaders, to understand what their challenges were, both in terms of immediate disaster relief, as well as like their longer term needs for emotional and mental well-being. As the recovery continued to progress, it really became evident that the burden of on the community leaders was really immense. Emotional, psychological toll of like leading recovery efforts while also grappling with their own personal losses really, really highlighted this urgent need for mental health support. And the funny thing is, as we were going through, as we began to form this partnership with the CREST program, we realized that this is like the new norm, right? That first responders are also grappling with the disaster or trauma themselves, right? So as we talked with the leaders, they began to describe being emotionally overwhelmed, really struggling to meet the urgent needs of both their neighbors, their team members, and as well as managing the weight of like this responsibility for their community's recovery. And this toll was leading to symptoms of anxiety, burnout, stress, which we knew if they were left unaddressed, it could really have long-term effects. Dr. Constance was talking about how we know that doing this kind of work can be very taxing, right? It's rewarding, but it's also very taxing. And so we began to recognize the toll it was taking. And it became obvious that the leaders needed trauma-informed care. And they expressed the fact that they needed some sort of trauma-informed care. And so it just so happens, so as GHA said, well, how do we begin to respond? We need to find someone who specializes in trauma-informed care to come in and work with us and work with these teams. And it just so happens that, as Dr. Constance alluded to earlier, she and I have known each other for a number of years. We worked together on some HIV prevention interventions back in the early start of both of our careers. And I knew of the work that the CREST program was doing, but that was it. We knew of this work. And so we reached out to the CREST program thinking, okay, we understand that they're doing this work. We didn't have any idea what it would entail, but we thought this is the first place. This is someone that at least we had some sort of relationship with. And what happened is, as they agreed, we met and they agreed to work with us and work with our Kenyan implementing partners. This relationship blossomed into something that really became more than we expected. I think more than the CREST program expected, and even more than what our Kenyan implementing partners expected. So we look forward to sharing with you over the next few slides how this partnership continued to blossom and to be effective in the lives and the organizations of these three very unique organizations, ours as well as our implementing partners in Kenya. Thank you.
So you're wondering, okay, so what actually happened? What did we do? And so Bwalya and I will talk about that a little bit. So I'll start with what activities. So of course, we provided culture-centered trauma-informed care. We used our CTIC model, CTIC, the CTIC model, and we began with some workshops. So we started with a series of workshops in which we provided them with just information about what are some evidence-based coping strategies that the Kenyan leaders can use for themselves, for their team, for the people that they served. We talked about, the what's in your backpack and listing what kinds of things would you need as resources, whether you consider that to be a digital list of things, whether you had an actual backpack or, as they say in the UK, a rucksack on your back, and what would be in that in that bag. And we talked about radical self-care and what that meant for people who are leaders, for people who serve, and how difficult it often is for people who are caretakers of others to see the importance of self-care. How do we frame that culturally so that everyone would be able to embrace that as a coping strategy? Once we move through with the knowledge acquisition so that we knew that they had acquired an understanding of what some coping strategies might be that they could utilize, then we moved into coaching. And in the coaching, what we did is round it out. So we wanted to be able to provide support to them as they are implementing what they've learned, again, with their team or in their service provision in communities. What difficulties were they having? What successes were they having? And we use breakout rooms, and we use those to work with individuals. So sometimes we did one-on-one. So it could be that a leader needed to share personal issues that they didn't want to share publicly or with their team members, but they had some questions that they wanted to ask, or they needed more support. Or it could have been an individual organization. So rather than dealing with everybody all at once, all of the organizations, all of the members who might be present in one of our sessions, we might work with a particular organization, a team, and so we would work with them around some of the activities and interventions that they were implementing to be able to work well together. The other part of that is a digital toolkit that we are developing to give to them so that they can continue to do this work on their own as they face new challenges and so on. It's anticipated, you'll hear this in another slide, but it's anticipated that we will provide the train the trainer training so that they too can facilitate workshops within their own setting. These sessions, just so you know, were 2 hours. They were online using Zoom. We have not yet had the opportunity to go to Kenya and meet people in person. So all of this has been happening in a digital space. So we've been bending this digital space to meet our needs. So that pretty much is the training design, and I'll leave it to Mr. Mubanga to talk more about the activities.
Thank you, Dr. Cirecie. You know, an accident happened in Kenya. There was nothing like, can we plan for this accident? That accident was a flood. We had already started working, as you heard from Dr. Charsey. We've been working with the guys, the teams, from 2019. All of a sudden, the pictures you saw, a lady old enough to be my grandmother being carried across the water. It was terrible. So the response is not business as usual. We had to sit down as a team at GHA. Who can we work with? Who can come in? There's nothing like, because as we were talking, as we were discussing, the situation was becoming impossible for the Kenyan implementing partners, our partners. So when somebody is saying, oh, partnerships, you may think there was like a legal framework. What's your name? For how long? You know, those legal attributes, no, there was no time for that. No MOUs. We had to attend to the issue that was on the ground. And this is why, without asking questions, both institutions, GHA and CRESTSprogram, had something in, we blended. So obviously when Dr. Cirecie is talking about the planning sessions, the meeting times, making appointments with the Kenyan implementing partners, obviously, as I conclude on this session, one of the best achievements that we did, not just as GHA plus CRESTSprogram, but also for the Kenya implementing partners, was planning and, more importantly, debriefs. The debriefs is something that you discuss after you do an action. And the debriefs were looking at two issues: a review of what you succeeded in with, and also a plan for what to do next. A feedback from our implementing partners shaped the way of what next to do. So during these activities, that was our backbone. I don't want to go through what Dr. Cirecie has mentioned, otherwise over to the next slide.
Thank you. So we're going to pause right here. Oops, I hate when it does that. We're going to pause right here and see if you have some questions. There already were some questions in the chat, so I don't know if any of the team has already been answering. I saw that someone immediately said, how can we reach out to you and partner? So yeah, we are here and available, absolutely. And so I've provided the information there. You can reach out to me via email, or you can set up an opportunity using Calendly to make an appointment to talk about partnering with us. But more than that, what's on your mind? What are you thinking right now about your organization? We haven't even gotten into how this thing just spiraled into a sustainable partnership. But right now, where are you? What are you thinking? What questions do you have? What thoughts do you have in terms of what you said about what you want to get out of today's session, right? So I see, yeah, you already want to connect with us. Absolutely. Yes.
Dr. West-Olatunji, there are two questions in regards to the partnership already. I don't know if you want to answer them now or save them till later, but one says, how did you deal with the time change and cultural differences? And the other asked about issues with language access.
Yeah, so we'll put that to the panel. I'll jump in, but would someone like to start?
I can start. So we had already been meeting with like I said, we've been working with our Kenyan partners for several years. And so we here at GHA had been used to the time change, right? And so we try to make sure that when we were meeting with them, it was a convenience for both sides. And I think that's important to emphasize that, you know, it is about making sure that it's a win-win situation, right? And something as little as, okay, well, when are we going to meet? It can't just be convenient for one side. And so, and then with respect to the language barrier, it just so happens that most of the Kenyan partners that we were working with speak English as well as their native tongue. But one of the things that we have learned in that is that language is important. And so when we're working with them and when we're talking, you know, we can present things in English, but making sure that you have respect for the native language of the other partners that you're working with. So making sure that you actually recognize that, acknowledge that, ask questions, and those types of things.
Someone else?
Maybe Wendy?
Sure. Beyond language, the cultural components are very, very important. And, you know, one of the things that strengthens our team at Global Health Action is that we are an international team. Our team members are based not only in the US, but we have team members from El Salvador. Bwalya is from Zambia and lives in Zambia. We have a team member who's on the call today from Mali, who's a doctor in Mali and is a core member of our team. So we have an international team, and we are aware of how much our culture and our cultural values impact not only our health, but everything about our lives. And so that's also very much a value of the CREST program, and something that is core in their training and in their approach to their work. And so that became something that was woven into the work that we did collectively in this work with our Kenyan partners. And so Bwalya was, I think, when we earlier, there was some reference to Bwalya drops gems. Bwalya always has cultural, or he'll share, you know, and he'll say something like, you know, in Zambia we have this tradition of, and he'll share a tradition, or he'll say in Zambia we have a saying, and he'll share a traditional saying, and it's always exactly what you need to hear. It always touches me in a way. It's like this, man, that's what I needed to hear today. And so, you know, one of the things that we talked about, even if we were talking about tidbits of kind of core psychological knowledge, or something that was like, hey, here's a stress, you know, something you can do. We would then talk about culturally, is that something that works for someone in Kenya. And then as we got to know each other all better, and the CREST team and the Kenyan partners, some of whom I think are on the call today, and they can certainly share their own experiences, as we all got to know each other and trust each other more, people would then talk about how culture played a role in either a positive and sometimes perhaps a challenging way, of perhaps like, my culture expects this of me, and this can be a challenge for me to take care of myself, or this expectation can add a burden, and this is the extra step I have to do to take care of myself, or for each other. So there was a lot of conversation that was respectful, and that we learned from each other. And sometimes those were golden nuggets from each other's culture, where we would say, man, we all need to share that and hold that dear. And there were other times that we realized our own cultures created barriers for us individually, and that we needed to sometimes work across those barriers ourselves, to give ourselves the grace for self-care, or for forgiveness was something. So it was very much a part of the dialogue. But it was part of the dialogue because we were open to it. We put it on the table, and it was done with, I think, respect, and an openness for that to be part of the conversation. And we all shared from our cultural experiences. So that and that included religious experiences. There was diversity within that. Um, so language was a piece of that, but not the only piece of the cultural diversity that was, I think, critical to the richness of the cultural piece.
Mm-hmm.
We have a few more minutes in this question and answer period. Are there other questions you'd like to answer, or does someone else want to weigh in on the same question?
I can say there's actually a follow-up to what was just said. If we want to throw that question in real quick. How did you build rapport and trust? Respectful conversation, other activities?
Quickly. I would say that one of the things that really impressed me about GHA was how quickly they wanted to implement services. A lot of times when we meet with agencies, they're like, well, we're going to talk to this group, we'll talk to this group, we're looking at starting in maybe the next 3-4 months, and let's talk about it, and let's give me some dates, and we kind of go back and forth, and it takes a long time. GHA was like, can you come this week? And it was like, this week? Okay, you meet every Friday. All right, probably not this week, but maybe next week. So it was like, okay, I think the first piece was, given the strength of the individuals who serve as Kenyan implementing partners, as individuals and as organizations, given the weight of the and the magnitude of the issues that we're facing, it was like they really need services as soon as possible, and they want these services. So what can we do to make this happen? GHA was like, I was like, how soon? They were like, as soon as possible. Like, we told them last week, we're thinking about this week. And it was like, okay, I don't know if we can do this week, but definitely next week. And it was like, okay, so we have to pull this piece together. It was about meeting. It was about really sharing and to understand what it was that was expected. I think it was about having a common vision, this idea that it's important to provide services. One of the things that really touched us was the idea that, the Kenyan implementing partners were dealing with the idea of, who cares for the caregiver, right? Who cares for the person who is out there doing the work? And it's a matter of, who you are. If you're dealing with a very heavy situation, a very traumatic situation, even the strongest people can sometimes, of course, get tired. And so it became this thing of, we have all been in those situations. We're all people who want to give and care for the community. And so that was something that we shared. And it became, we have to provide these services, and we're going to provide these services. We're going to work out the logistics later, and we'll trust that you're going to be fair and work with us. And hopefully you will trust us. But the bottom line was, let's get these services to these Kenyan implementers as soon as possible. And I think with us being on one accord about the importance of addressing their needs, as quickly as possible. It meant that we had to get everything else in line. And we were able to do that by listening to each other, understanding each other's missions and true goals. I think there was a lot of transparency in terms of, what it is we were hoping to do, keeping up with whatever we said we were going to do, at least giving feedback. Okay, this is what we said we're going to do, either, delivering on time. And if not, then to say, okay, here's my situation. It's not like I forgot, or I just told you that. Let's just, be honest. Other things have come up. And I think that made a big difference in terms of us developing a baseline level of trust. And then over time, it has just continued to grow as we've interacted with each other. I don't know, someone from GHA wants to jump in and chime in, or somebody else from Crest wants to weigh in.
I
Yeah,
did
I'd
want
like
to
to.
jump in. Oh, go ahead, Dr. Cherry.
Oh, I'm sorry, Dr. White. So I just want to add one thing that to what Dr. West was saying. We recognized early on, we as in GHA recognized early on that it took time for us to build the trust with our Kenyan partners, right? And so we're bringing someone else in, and it's going to take. Now they trust us, right? And so we had to bank on the fact that because they trust us, that they would trust this organization, but it was going to take time. And so that was something that we needed to recognize and sort of step back and say, okay, let this process happen where they begin to build the trust. And why I say that is because sometimes it was hard in the sense that, we were used to meeting with them every week. And then we brought this new organization in, and, they're presenting, and sometimes there's silence, right? And it wasn't because necessarily that they weren't involved. They were maybe just absorbing. And so we had to from our perspective, GHA's perspective, say, okay, let's not jump in. This is part of the process. Let Crest continue to do what they do, and let the team members from Kenya begin to see that, hey, we trust them enough that we can sit back in this meeting and not feel like we need to contribute because they are the experts in what they're saying. And so you have to take that into account. I think that was one of the things that really helped us.
Absolutely. And I think with the time difference, and because it's late in the evening for them and it's super early, especially for Dr. West-Olatunji, now that we've had this time, I think she's doing 7 a.m. and they're doing 8 p.m. So it is a challenge, because I'm sure it's the end of the week. It's a Friday night for them. It's super early Friday morning for us. So it is. I mean, and then there's a lot of issues related to technology. So I would say that those are barriers as well, in terms of people having reliable access to the internet. Sometimes they're sharing, and so you're also counting on people feeling comfortable talking in the same room with someone else, and we don't really know all the dynamics about them. So there's a whole lot to be dealt with, and it seems as though it takes a while for us to get fired up. We get started and it's kind of slow, and then towards the end of the session, it's like now we're really popping off and things are happening. It's time to shut things down. So it had that part, I think, in terms of working with the Kenyan implementing partners, given there's so many challenges related to that. It's been really amazing, but yes, it has taken time. And so one of the things that we did was we extended the didactic portion because we felt as though we needed a little bit more time in that section of the implementation before we moved on to the coaching. And we still had to be very flexible about what each session looks like. It may not be all coaching. It may be some didactic. It may be sometimes people are doing one-on-one. Sometimes they're doing them in teams. So we have to be very flexible because sort of what we were thinking initially based upon where the Kenyan implementing partners were before we got there, and then when we first started versus where we are now. And so it really is about really being very open to changing formats and changing the content, changing the approach or the introduction, and also getting comfortable that, the silence initially was like, okay, what does that silence mean? But then when we would do our recap, people had a lot to share at the end that they may not have been expressing a lot during session, but they were really processing a lot and were involved behind the scenes, sort of, to speak. So I know we're a little bit over in this Q&A. So we're going to have more Q&A sections of this presentation. I wonder if we need to go ahead and move on to some of the outcomes. So what were we able to achieve in terms of outcomes?
Before we do that, I know that Dr. White just wanted to add one little thing, so let's get her comment in and then we'll move on.
Okay.
Yeah, and I'll be brief. I just want to say, even with Global Health Action and the Kenyan partners and then CREST and Global Health Action, one of the things I was really impressed with was just the genuine care that was displayed among all the partners. And so there's a saying my mom used to say all the time when I was a kid, saying that people don't care how much you know until they know how much you care. And so I know we'll get into this a little bit in the presentation, but it wasn't just at the beginning of our meetings where we would check in with one another, but I was really impressed with how the engagement throughout was just caring and checking in and making sure people were seen and then following up as well. So not losing the humanity in the work that we do also helped contribute to rapport and trust building.
Absolutely.
Thank you.
So I know Dr. Cherry gave you a little bit of a teaser. He said there were a lot of unexpected outcomes. So we're going to talk about the things we were hoping to achieve from the outset. And then we're going to talk about all the things that happened that we really didn't anticipate at the beginning.
Yes, outcomes. So, that's always what matters in the end, right? We go into partnerships with expectations, and then there's what actually occurs. And I think this is, probably a partnership that had more outcomes than any of us dreamed. And that is a fabulous place to be. It's an incredible experience to have. And I think that's one of the reasons we have all been so excited about this partnership. Certainly, there were a number of outcomes that we had hoped for that are, the reason that we reached out, as Charsey said in the beginning, is because at Global Health Action, our implementing partners in Kenya, some, as we mentioned, who are on this call, were struggling. In an initial meeting that we had with them, we literally just said, we're not going to do our regularly scheduled events for today. We just want to put all of that aside, everything we had planned for today, because we were doing our regular meetings on Friday. We were working on a community health assessment that we were gearing up for. We would always, as people were coming on the call, how are you doing? And they were going, fine, fine, fine. But meanwhile, we were receiving the photos that we were sharing with you. Some photos that we didn't share with you, where literally there was a photo of one of our partners where they and some of their neighbors, community members, were on a roof for safety because the flood waters had risen so high. But on the edge of the photo, on the edge of the same roof, were bodies wrapped in sheets. And this isn't a community that they go to work in. It's a community that they work in and they live in. Their families live in. And so it's not just people that they happen to know who are being affected. It's people they know and love who are being affected. Some of their colleagues are being affected. Some of their family members are being affected. They themselves are being affected when they're sharing stories that schools are being closed down. Their own children's schools are being closed down. When they're talking about health centers being washed away, those are the health centers that they and their families access health care to. So they're saying this as if it's third party, but we know that they are being impacted in their own daily lives. These are pictures of their communities. And so when we just kind of said, how are you doing? Not how are you? I'm fine. But how are you? Because let's be honest, this work is hard every day. The work that we all engage in is hard. And as people began to open up and share that they were struggling. And I think Dr. West had referenced earlier, I think it was Dr. West who said, one of the very first statements that was just a real clear call for help was one of our dear partners said, "Who cares for the caretakers?" And that really became kind of the rallying call for us as a global health action team of we have to do more than just give them resources to help their communities. Our partners, the people we know and care about, they need support too. They need support as leaders to help lead their teams, but they also, and to respond to their communities, but they also need support as human beings, and surviving to keep doing their jobs, but also as human beings who are living in these communities and who are dealing with the issues that other people in the communities are dealing with, but they're playing this additional role because, as they have shared with us, everyone in the community comes to them as the person who can support everyone else. And so how can they keep doing that when they themselves have no fuel left in their tanks? And so as this partnership began, we realized that there was kind of two pieces. We needed to first help people put their own oxygen tanks on, and oxygen mask on, and then be able to help the folks in their community, everyone else put on their oxygen mask. I think that when that is said to me on an airplane, mothers, parents, if you're traveling with someone who needs help, put your own oxygen mask on first and then help the person beside you who needs help with their oxygen mask. There's so much truth to that. And so we realized in reaching out that needed to be done. And so that's why there was kind of these two parts to the training. Let's first focus on providing some support to our partners for themselves and their organizations, and then the help they can do for the community members. And so those outcomes we have been seeing the progress on. But then there was this entire additional magic that happened that we had not at all thought about or expected. So as Global Health Action, our core team, the three of us who are here today with you, and then two others who are here who are not presenters, but who are also here in the webinar. The five of us participated in the prep work each week, some of the planning work with CREST program. And then we also participated in the sessions and supporting our Kenyan partners. And we would always afterwards debrief. We would have our own debrief, which we often do. And we realized as we were debriefing that we not only debriefed about kind of how did we think it went for the Kenyan partners, but we were also debriefing about what we learned, what we ourselves had taken away, because we were learning every week. We were gaining tools to use. We were beginning to realize, wow, I've just had this insight, or I can use this. I haven't realized that, I don't really take care of myself in this way, or when I'm really stressed, I keep plowing through, or I don't trust letting my team step in to help me when I'm sick. I just keep working through. And so we began to realize that we were learning and we were starting to make changes individually and then also as a team. And that led to changes as an organization. And we began to realize, well, that's makes sense because as an organization, Global Health Action uses the social ecological model. And this is something we believe in strongly. And we've been preaching this for a number of years. So I don't know why we didn't think it applied to us as well. So if you're not familiar with the social ecological model, it really is a comprehensive approach to understanding and addressing the multiple levels of influence on health behaviors and outcomes. And it informs the development of multi-level interventions to promote health. And so if you see the model there, you will see that there is this understanding that there are all these different levels of influence on our behaviors. And so it also, and I think as we began to really look at this, there's this sense that change doesn't happen at the smaller or at the bigger levels without change happening at the smaller levels. And so you're not going to have, for example, change at an organizational level if you haven't had change at the personal and the interpersonal level. And so if we're having change happening, it starts to have these impacts at different levels. And we have really, as a result, as an organization, as a team, had tremendous change this past year. And that has been tremendously helpful for us. And it's also made us realize that our other programs could benefit from similar trainings and similar support, not just this one program. And we realized that this program would have benefited even had the floods not happened. That was the impetus for it, but we all would have benefited. All communities would have benefited. All leaders, we think, would benefit from the support and the work that we've done together collectively. And as a result, we had been working, the two organizations, our partnership is growing because we're now submitting grant applications for funding to bring customized, similar, but customized to other programs to work together on doing some trainings and some support work to our other programs within the Global Health Action portfolio. And so what we really thought was going to be an outcome of, we're going to provide some support post-trauma, post-event trauma event for one specific group of community leaders in Kenya has now changed our organization, has changed us individually as team members, certainly changed me as an organizational leader, and has also now changed how we're looking at every single program at Global Health Action. And that is in no way what we thought initially we were starting to do when we reached out to CREST program. But I'm so grateful that it has done all of this because I know we're a better organization. I know we are better professionals, and I know I'm a better person because of all of this. Yeah.
Wow. Well, yeah, so clearly in terms of outcomes, there was so much more. And I think that we've gotten greedy. We're like, okay, we did all of this in a short amount of time working with the Kenyan implementing partners. And part of it was that the Kenyan partners had already indicated. So sometimes what happens as mental health professionals is that we're brought in to talk to people about the possibility that emotional factors are impacting their ability to work. But what was wonderful is that the Kenyan partners were already there saying, hey, we really need support in this area. And that GHA was already there saying, hey, we need to support our Kenyan implement partners because they're going through a lot, both personally and as community members and as leaders, et cetera. And so when people are aware that they need to increase their ability or their activities to support themselves, and the agencies that we work with are ready to make changes and are open to unexpected but wonderful changes, like the ones that Wendy has already identified, then yeah, our work is fantastic. We can really do a lot. Doesn't take a whole lot of people to achieve amazing outcomes. It just means that those few individuals need to be of one mind and accord and are able to build that trust and to be honorable and to honor that trust, and have the trust of the individuals in the communities that they serve, so that we can really move forward in an authentic place. We can talk about what we're really feeling, what we're really experiencing, and what we really want to do to make things better. And when we have that, we're able to, move mountains, really, and to achieve even more than what we set out to achieve. We thank everybody involved for being open, to being courageous enough to talk about difficult topics, and to be open to making those changes. Because GHA could have been the same thing. Oh, we're going to help the Kenyan partners, but I'm not making a change in my life, or we're not making a change in our organization. Or you could have not even been in the meetings. You wouldn't even have heard what was going on. You would have heard it from the Kenyan partners. And so I think it really was about everyone being open, from the Kenyan partners to GHA and also to members of our team, to say we know what typically happens, but we want to make sure that this process works, and to make the appropriate adjustments to make sure that we achieve what we set out to achieve and more.
All right.
All right. Dr. Cherry and I will go through and talk to you about how we've already started to expand the partnership and future plans. Dr. Cherry?
Yeah. So as you've heard, this partnership became even more than what we expected, what we intended, and it began to quickly evolve into an expansion. And I'm going to say that this expansion happened, and these ideas for expansion happened based on three factors. One is the work that we were doing, right? And we were starting to do. Two was timing. And three, and to me, most importantly, was divine intervention. It was just meant to me for this partnership to blossom in the way that it did. So as Wendy was saying, we realized after what we were learning about ourselves, about our team, about our organization, and what the Kenyan implementing partners were learning, we began to realize, you know what? Our work is about social justice. All of our programs, right? It's about helping people. It's about social justice. It's about equity, looking at things from an equity lens, and it's about culture. And so we said, what we've been doing is going to be beneficial in all our programs. How do we begin to do that, right? And it just so happens that one of we had been looking at, GHA had been looking at applying for a grant for our capacity building ripple effect program. And the funders, the deadline was like, okay, well, we won't be able to apply for this particular grant right now, but they send out this opportunity over the course of the year. So there's going to be another opportunity that's going to come up. And so here's why I say timing and divine intervention as well. So we're looking at expanding this cultural-centered, trauma-informed care into all of our programs. And one of the programs that we run every quarter, semester, is our Global Health Equity Leadership Internship. And we thought, and that program brings in interns from all across the world, right? One summer we had 14 time zones that were represented in our internship program. And so we're thinking about, okay, how do we put this in the internship program? And it just so happens that when the new grant funding came out, they were talking about providing funds to look at partnerships, right? And innovation in doing something with the partnership. And we thought, oh my God, timing. And so we decided that, hey, wouldn't it be great if we did this together? Not that GHA was going to write this grant and say, oh, okay, we wrote a grant, will you guys be involved? No, we did it together. That was one of the beginnings of this expansion. And we just started finding more and more opportunities of how we continue to work together. It started changing the structure of our meetings. And I'll tell you, I'm going to tell this story and then I'll turn it over to Dr. West. So as we were looking at this grant funding, and we were starting to have meetings to kind of lay out what the grant would look like, we recognized that with the Ripple Effect program, what we were doing, we had already built that program, or we built that program was being built. The trauma-informed care program to support that was being built as we were going along. But we had the opportunity to look at this in a different way. And so CREST program came back and said, here's what we're thinking for that. And we were in this meeting and we realized, oh, wait a minute, they don't really know what happens in the Global Health Equity Internship Program. So it's a little different. It's got to, and so we started describing to them, because it was on our part that we had not described. We just talked about, let's do this grant together, right? And so they're like, okay, here's our part. We've laid this out, based on what we know. Is, oh, I'm sorry. So here's what this program looks like. And in that meeting, the CREST program team rewrote the proposal for the other program. And it was spot on because they were listening and we were working together, not like in this silo. We worked together and we knew that was an aha moment for me. I was like, oh my God, right? And we all have these aha moments that we've had. And we sing each other's praises all the time because of the way that we've been able to work together and how some of these expansions have started to shake out. So I'll won't take up more time and go ahead and let Dr. West chime in on our expansion efforts and plans.
Yeah, absolutely. Yeah. So there were a bunch of aha moments. I think that another one was when we were working on that grant on the October 30th for October 31st deadline. Even before that, when GHA was saying they were going to put this thing together, it was like, really? Okay. And this first out of time. Okay. And then it became, all right, we have to get this thing done. And we ended up staying up all night long. And that's when I found out that I really could work with Wendy and Dr. Cherry, because it was like, okay, you find out the real deal when you're kind of sleepy and cranky and whatever. And then it was like, okay, after we got all the work done, it was like, I'm going home before the grant had even been submitted, right? Usually I would have been like, I'm going to stay until it gets submitted because I want to see it go through. It was like, nope, I trust you. I'm going home. I'm going to bed or whatever. So it became this thing of really deepening and really trusting the water. So some of it is. It wasn't that we had planned to do an all-nighter. I know I had not. But it was about, we want to get this thing out the door. And is it seem almost impossible? Probably, but we're going to make it happen. The other piece is having a really strong team. I think that GHA has a great team and CREST has a great team. And we all have different strengths. And it's wonderful to be able to say, oh, you're going to do that? Great. I don't have to do that anymore. And so being able to say, okay, there are people here on this team who have strengths in areas in which are not my strengths, right? Or even if it is my strength, it's something that allows me to focus my attention on something else is really amazing. And We'll talk about that later. So I want to talk a little bit about the grant writing sessions. We talked about that. We definitely did an overnighter. Cross training. CREST program was able to identify some funding to allow us to provide trainings to community-based organizations who were out there, grassroots organizations, and we were able to provide a spot for Dr. Cherry to come to New Orleans and to complete one of our credential programs, which is called CREST Liberate, which is an emancipatory research credential program. So that was really great. So, we were able to, identify some funding for that as well and be able to cross train. And we're hoping to be able to train other members of the GHA team in the future. In terms of disseminating the information, it's like, okay, I've been so many times part of these really amazing programs where we're doing a lot and everybody's just working hard, but we weren't putting the word out there about what we do. Some programs are out there doing the hard work, but not tooting their own horn or not sharing what they've learned. And other times, other groups share a lot, but they're not doing a lot. And so people get a perception that other groups are doing a whole lot because they're doing their own PR. We said, okay, hey, we've seen this. We've seen situations in which partnerships did not work. So how do we share when, the outcomes expected and unexpected that happen when you have an effective partnership? So we said, well, what can we do? We said, well, let's just at least let everybody know that we are in partnership with one another by sharing our logos on our respective websites. Let's go ahead and write some articles for our newsletters. So just in terms of our correspondence, I know the GHA did a letter, and their letter that they send out, I guess every year at the end of the year or something like that, they had an amazing article about our partnership. It was really awesome. And we did the same thing in terms of our article for our newsletter. So we have a quarterly newsletter, and it comes out in December for the winter. And we had an article in our newsletter on GHA and our partnership and the work that we've been doing. Of course, third bullet is this joint webinar. We're also talked about doing some conference presentations. I know Dr. Cherry can talk to you about that. He has done that, and we're proposing that we do some journal articles. So, Dr. Cherry?
Yeah, we've already submitted a couple of abstracts for conference presentations. One of them did not get submitted or accepted, but we're waiting to hear on the other one that's going to happen in June. But we are fully dedicated because we even in our meetings, as we were talking about the expansions, and the work that we were doing, we were adamant that, listen, we need to put this out there. We need to go to conferences and present. And we come from, although we do work that is within that sort of the same arena, it's a different focus. And so we have different audiences. And so we recognize that, hey, what are conferences on, from your perspective that we could present at? What are conferences from our perspective? And then, this webinar being one of the first, just a way to continue to share what we've been doing together, share it with others, as well as finding ways to continue expanding the work that we're doing, because we all feel like that this work is just really valuable. It's really needed. And we are so happy to have this opportunity to do it together.
Absolutely.
All right.
So next, we're going to get some more input from all of you who are here with us today. What do you think are some of the most common reasons that partnerships fail? You can go ahead and use the chat feature in Zoom.
No, not the chat feature. We're using, I think, the Zoom.
There's actually a Zoom poll. Rather, we're not going to use that feature.
There you go. Okay, so you should now see it on your screen. The power of partnerships. What do you think are the most common reasons that partnerships fail? Let's see. Ooh, you guys jumped right on it. My goodness, you're responding very quickly.
They always do. They come lock and loaded.
Yeah. Yeah. Okay, so Oh my goodness, you're still answering. Okay. All right. I can see a couple of the responses you thought weren't even worth looking at. And then we have some very definitive views, I see. I'm going to share it with you in a little bit. Yeah, okay.
We
So
can
we
see
got
that.
about 66%. So, okay, people are still answering. I'm going to leave it up just a little bit longer and see if a couple more people want to weigh in, but it's very clear that you all have a general idea of what you think the answer to this question might be. Yeah, good. That's a great response rate. We've got 73% of the participants responding. So I think I'll end the poll right here so I can share it. Yeah, so you should be able to see the results of the poll right now. So 86% of you believe that culture, leadership, fear of control, and lack of time all inhibit successful collaboration. And a few of you are a little salty. It's like organizational leaders are too incompetent in their management skills. True, some are. True, some are. But it may be that it's a big of a more broad and comprehensive kind of view that's going to get us to solutions. So yeah, it's from the research on partnerships between organizations, culture, leadership, fear of control, and lack of time all contribute to the success of collaborations. Thanks.
Excellent. And thanks for including that as a poll.
Sure.
All right, so now we're going to move on to lessons learned. We're going to have Bwalya and Dr. White.
Absolutely. I'll get us started and then throw it to the wonderful Bwalya. And so some keys, and this speaks to some of the questions that you all were asking in the chat and in the Q&A portal, keys to developing and maintaining effective partnerships. And so first and foremost, there has to be a shared mission, shared goals, right? And so both partners have to be equally committed, bring an equal commitment to what they're working toward. And so that involves some prep work taking place, conversations, meetings, right? So preparing to begin. If we think about, I have a counseling background. And so I think about the stages of change, right? And there's pre-contemplation, contemplation, planning, and then action. So all of those things have to happen before we implement the plan. And so one of the things that occurred in this partnership was a self-assessment, right? Making sure there was shared definitions and shared meaning about what we were trying to accomplish to ensure that we were on the same page. And then we wanted to make sure that we developed trust. We spoke a little bit about that earlier, making sure there was no hidden agendas, right? Sometimes people come into partnerships and they're doing it for, and they may have like some ulterior motive. So I need this to get this type of funding, or I need this to put it on my CV for this award, or whatever it may be. But just making sure that there was transparency in the relationship building process. And of course, it's important to recognize power dynamics that can occur in any relationship, but particularly in partnerships, right? Everyone in this space is bringing some level of expertise, right? So people, we know what we know, but we don't know what we don't know, right? And so respecting and honoring that, information can often come from unexpected places, and that everyone brings expertise and experiences that can contribute to the success of the project. And so making sure that when we are using our power, that we're not coming from this place of power over or dominance, but power with shared power, so that we can all get to our goals. All right, I'm going to pass it over to Bwalya.
Thank you. I want to look at it from the African perspective when we are looking at lessons learned. In Africa, we have chiefs, traditional leaders, they are highly respected by everyone, including presidents. What happened? It's a folklore story. 3 were invited to meet at a given river. So they were told, you are not coming with crowds. You come alone. So this guy from the West traveled alone. The other guy from the South alone. The other guy from the North alone. So they arrived almost at the same time. And then the weather was not very good. It was like what is happening in Atlanta right now. Kind of cold, and it was cold. So each one expected, because these guys are highly respected. The way it happens, when you meet them, you have to kneel and clap, I don't know, 50 times. And you are told, you can now stop clapping, you know? That kind of respect. So when they saw the other two, these guys, haven't they seen that I'm a traditional leader? Why are they not kneeling and greeting me? Now imagine each one of those three was thinking the same. Those two, they seen that I'm the greatest here. Now the weather, which is in Atlanta, okay, even if they don't greet me, can't they at least make some fire? Can't they see it's cold and I'm their boss here? Each one was expecting the other person to do the same. It became colder. They had carried the raw food, you know? And impala, you know, the animals of Africa, impala, kudu, those, tasty bushmeat. They were expecting the others to cook for them, to roast something. You know what happened? They all died, hungry, miserable. The story I've told is just the opposite of lessons learned. Look at the CREST program team. What do you see? Doctor this, doctor this, doctor this. Now look at how they behave. Are they behaving like the Zambian traditional leaders? No. They forgo those titles. And as you can see, the hands that we have showed in this diagram coming together. Look at the colors. They are black. They are just the way you see us. So when we are looking at lessons learned, we forgo our backgrounds, you know, the databases we have done for example, I used to do databases for the whole country. What is that at the moment? We just have to come together, do the job. So that is why when you look at words like humility, I've explained. Openness, I've explained. Opposite of openness. Mutual respect, capacity to devote, courage and transparency. All these things can be extracted from my story, because if you use the opposite, like what these three guys did, you die. We're talking of partnerships. Partnerships can simply die by the Atlanta weather. That's the end. So we forgo who we are, we forgo our Andy, go for the objective. Over to you, Dr. Cirecie.
What am I supposed to say after that? See, now you know why we love Bwalya, because he brings it on home, brings it home, clear, makes it crystal clear. Absolutely, absolutely. Love it. Yeah, that's it. That's it. You have clearly covered it about lessons learned. Absolutely beautiful. If we do not cooperate, we will starve. Absolutely. I love that. Yeah. Um, I don't know. Dr. White, did you want to say anything?
After that, no, that was a beautiful story that was able to capture all of what was on the slide. So thank you, Bwalya. You did as you always do.
Thank you.
Yeah, so you can see we benefit as well, very much so. It's mutual. It is mutual. Well, I see you all have more questions. I saw there were some questions. I answered some in the chat. But Dr. Bo, are there things that we should be paying attention to?
So yes, you did answer the one in the chat. There's still two in the Q&A, and I'm still really impacted by the story. So if my language is not very clear, I apologize. So first question, well, this may not directly apply to the partnership. How can one navigate power dynamics effectively to build trust and foster power sharing and collaboration?
I
would say that's a cultural piece of an organization, right? You don't start that with a collaboration or a partnership. I think it starts with who you are as an organization. Um, and I mean, and I say that because that's something that we work towards and every day at Global Health Action. You know, we are aware of power dynamics constantly because they exist. And we, I think when I first arrived at Global Health Action, what I found, one of the things that I found very sad was I was told about partnerships that we had in multiple countries. And when I went to meet with many of those partners, I learned that we at Global Health Action was using the phrase partnership, but our partners were using the phrase donor, or they were using the phrase, they were using other phrases. They saw us as having power in the relationship. They saw us as being the decision maker or the lead. And clearly, the folks who had worked at Global Health Action before me had not intended that. And that really made me pause and think about what we could do differently, what we needed to do differently every day. And so it's not enough to just throw out the word partner or throw out the word collaborators. However you translate that into a different language. The meaning behind those words is about the actions and the relationships that you're building every day. And so it's work. You know, it's work that you do in all of your interactions. And that takes a lot of thought. You know, one of the things that was brought up earlier was about listening. You know, at Global Health Action, we're very clear that in our partnership with our implementing partners, the community partners we have, that programs belong to a community. They don't belong to Global Health Action. We're there as a walk alongside partner to help communities perhaps learn skills, perhaps get access to additional information, perhaps implement a monitoring and evaluation component. We're there for the long haul, but we are there to listen because communities know the issues and health challenges they face. And communities know what works culturally in their communities. They often have an idea of what solutions can work. And they know what the stumbling blocks are. They may need help in identifying entrance to get to a table with decision makers. They may need advocacy partners who can get into certain rooms or who can speak to someone that they can't get an audience with initially. They may need some materials, or they may need some thought partners, but it's not that communities are without information about what their problems and their solutions are. And so we need to go in respecting communities' knowledge and not think that because we sit in the United States that we are all knowing and knowledgeable. We are usually the least knowledgeable at the table when we walk in. We're there to learn, and that's why we need to start by listening. And it is often, I am aware that when I walk into some meetings, the sad truth is my white privilege may be the greatest thing I bring to the table, because I might be able to get a meeting scheduled that someone else can't get scheduled, because by walking into the National Ministry of Health and being from the US And because when I walk in, everyone at the desk turns to look at me and goes, "Oh, you can go to the front." Like that alone may be the greatest plus that I can bring to someone to get them access to something. Not that I know more about anything than anyone else at the table. I might simply be able to get them a meeting that they couldn't get. As sad as that is, that may be what I offer. So I think it's really, really important that we are listening, and we are aware of all of those components. And you don't start that when you begin a partnership. It's something you've got to work through. It's murky, and it's a organizational commitment every day, I think, is what I would share. And I invite my team to say more.
Jesse.
No, I would echo a lot of what Wendy says. And I think that one of the most important things is to realize also that although there are cultural differences, love is a universal language, right? And we can find a way. And this has been this is one of the things that we've done throughout this partnership and working with our Kenyan partners, is that the cultural saying or tradition might be different, but the meaning you can translate, right? And that comes from a place of knowing that there is a universal language, right? Which is love. And what we're doing is, when we come into these organizations and these partnerships, particularly the work that these two organizations are doing, we come in out of a place of love and wanting to make a difference, right? And so we've talked about how we just check our egos at the door, right? Because we're out for the greater good. And when you are pursuing work for the greater good, despite the cultural differences, right, you find the interpretations or the meanings, the connections, right? The connections are always there. You just have to find it. And sometimes that takes time. And that takes time it's easier, I should say, when you recognize that there can be power dynamics, but you have to put that aside. You use it, like Wendy says, when it's beneficial, right? And beneficial doesn't necessarily mean to lord it over someone. It's to help. Beneficial is to help, right? And so I think those are some of the things that I would say that's important in terms of the culture.
What I just wanted to add is, Wendy, who you see there as our CEO and the president, if we were an embarrassment as a team at GHA, she wouldn't even dare agree that we partner with CRESTSprogram. There is a kind of discipline, allow me to use that word, that when we meet, we forgo who we are in terms of degrees or the kind of work we do. We simply ask the question, how are you? How was the weekend? How is your family? We start as a family. It helps us actually now to talk. We can perform. When you get access to what we have done, what we do, the kind of database we have, the kind of literature review we do, the kind of work that we do, it's not because we are the most intelligent or anything like that. It's because of the kind of platform we stand on. It is not fake. It is real. How are you? How is your family? Wherever you are recognized as an individual with a family, somebody is able to sleep on a bed. If people take you that way, then performance is just a walkover. And that's the kind of spirit we have at GHA, where we forgo who we are and we just say, how are you? And then from there, when tasks are given, we are second to none. We perform. Why? We've been recognized. Now, this kind of spirit, this kind of personality is that what we bring to these great ladies you see from CREST program. Any one of them can talk to any one of us. They would still feel they are talking to GHA. There's nothing like, I would want to talk to Charsey. No. We have one culture. Like Wendy explained, I'm here in Zambia. Our colleague is in Mali. The other one is in El Salvador. The two are in Atlanta, Georgia. Distance is not a barrier. For me, for the first time, that's when I understood. It's a phrase for some people, but it's real for me. Because the way we relate, the way we meet, the way we work, it's like we sit on one desk. And those are some of the essential ingredients. First of all, in an organization, that which will transfer into a partnership. Then, as they say, the sky is not even the limit. But if there is a problem at organizational level, no matter what kind of legal frameworks you use in your MOU with the partner to be or the current partner, it won't change anything. You may call the best speaker, the best whatever to explain things to you on that MOU. It will not change. Go back to the basics. Just say, how are you to your workmate? You will see why we are able to say, can we as GHA and the CREST program share that which we are enjoying in the year 2025? It's because we are happy. Thank you.
Thank you, Bwalya. I believe Michelle, one of the GHA staff members, had her hand raised, and I think I've allowed her to say something. Michelle, did you have a comment?
Yeah. Hello, everyone. Thank you for muting me, Dr. Cirecie. I think that was a mistake, but I am learning. I've been part of this process, but I'm learning so much. So thank you. And I hope everyone else is also gaining the gems and wisdom from our panelists.
Well, we're glad that you're here, Michelle. Michelle and I share the fact that we are the folks getting up real early for those Friday meetings. So she and I are a little yawning on Friday mornings, trying to get it together and be awake. And she is coming to us. She joins us. Where are you, Michelle? You live where?
El Salvador.
Yes,
In El
I'm coming from
Salvador.
El Salvador.
Yeah. Yeah, so we are meeting together with a lot of different time zones, a lot of different perspectives, and all coming together. What I find interesting about the questions today are, I think the people are amazed at what I hear in these questions. How are you doing it? How are you overcoming some of these things? Time is one. Another is trust that keeps coming up in the questions. And I love how we're answering those questions. Dion has a question in the Q&A feature of Zoom. And I would offer, I know I'm not as good a storyteller as Bwalya, but I would offer the example of the speaker who is about to give a large lecture, in front of a large group. And the speaker is in a hotel room. It's somewhere beautiful like Hawaii or something like that. The windows are open so he can get a nice breeze. And he has his lecture on some of the chairs. He has them laid out and organized in preparation. And then a breeze comes through the window, and his papers for his lecture are strewn all over the room. And for the first 5 minutes, he's gathering up the papers and trying to get them all together again, and is really frustrated until he stops and realizes something, right? And I've often asked people, what do you think he realizes? What's the deal? And it is that he needs to first close the window and then pick up the papers, because otherwise it's perpetual. The windows are still open, the breeze is still coming in, and he can try to pick up those papers, but he's going to keep wandering around trying to pick up the papers. So this issue that we have is that when we say we don't have time to develop relationships, is us trying to pick up the papers with the windows open. So it is important to stop, develop relationships, because you'll be able to accomplish your goals faster, right? So this is us saying we don't have time to be humane. We don't have time to develop relationships. We don't have time to be authentic. We're still picking up the pieces. So if we want to move faster, smoother, right? If we want to increase the quality and the outcomes of our work, we have to stop and prioritize relationship. And when we do that, we'll go faster. It will expedite our work, and we'll find that we'll be able to report to our funding sources that we have been successful in accomplishing the goals that we set out. So we, as you noticed, we've extended the time for this webinar because we knew that there were so many gems that would come out of our discussion of what happened. And we are so excited about what's happening in this partnership that we knew it would take a little bit more time. We are recording it, so we realize that if you have to go and get back to work or whatever it is that you're doing, we understand and we appreciate your time. But if you can stay, we have a couple of more things that we want to share as we close out. As we know, closure is very important. So if you can stay with us for closure, we'd appreciate that. So let's ask, what can we do right now? So who is my partner for this? Is it Bwalya?
Wendy.
It's Wendy, sorry.
So yes, I have the second and third bullet points.
Okay, so the first thing is use a collaborative assessment tool to take a look. It's always good to look at baseline and then also look at how far have you come. And this would be in looking within the organization to see the health of the organization. And also to take a look at how are the organizations coming together. So isn't it great that there actually is an instrument to be able to evaluate how well the partnership is going? Be open to the ways in which partnerships can lead to meaningful change on multiple levels, as you heard Wendy talk about, using the Brunson-Browner model of looking from the small to the large, looking at those multiple levels. Be willing to answer uncomfortable questions. So that means being a little vulnerable. Change can't happen without a little vulnerability. And then really do some self-reflection on your current levels of partnerships and collaborations to look at where you want to be, your vision, and what the reality actually is. So that's another opportunity to be honest with yourself.
One of the things that I think is really an opportunity with whether this is a current partnership, especially if you're struggling with it, and we've put partnership in quotation marks there, you'll see, or if you're evaluating a potential collaborative or partnership, is to really be honest about what a relationship is possible. And I say that because not every relationship is going to be a true partnership. And that's okay. We need to be honest about that up front. Sometime the best that can come from a relationship between two organizations is maybe you're going to support each other's communication, right? Maybe you'll like each other on your social media channels, or you'll support each other's events. And that's the most that you can do. I think you have to just look at what is possible, have an honest conversation about where you align, and what the relationship can be. It may be that you can do a bit more than that. There may be something you can do to coordinate around a particular event, or share some resources around a activity. But a real partnership that requires ongoing cooperation, that is going to build trust, that requires trust by working together, that is really going to require shared interest towards a common goal, and work together of two parties investing resources to achieve joint goals. You really have to be able to evaluate if that is what's on the table, if that's something that both parties can commit to and has the resources to work towards that. And I think that is what made this partnership a true collaborative partnership, and evident from the beginning, because when we first met, it was clear that we already had a shared goal, and our values as organizations lined up. We weren't trying to convince each other to do something. It was a natural alliance. And that, I think, is something that is unique. That is not something that I have had fall into place so naturally many times. I think that is actually quite rare. I feel like most partnerships, you might find a few things that you're in alignment on, but that there's a lot of what feels like convincing the other organization to fit into something that maybe isn't what they would do. You feel like you're really rallying them to fit into a mold that your organization needs them to be. Or you're feeling like you're being talked into something to be a partner for someone. That often feels like the case. And that was absolutely not when our two organizations came together. So I think really evaluating your vision and your dream and your hope versus the reality is doing yourself a favor. See what it can be, what it is, and make the best use of that, whatever that space is. And then wherever you are on that, whether it's a real partnership or something in between, having clearly defined SMART goals and activities, so that you know exactly when, who, what, all those goals are really clearly defined so that you can avoid uncomfortable conversations at a later date. We laid out very clear goals. We knew what was going to happen when, how things were going to play out. And if we needed to adjust those, we could. But then it was, hey, let's circle back to X This is the reason we need to relook at that, as opposed to, hey, we need to talk about this because we never really considered it. So I just really encourage you to think about those components with partnerships or communications, whatever your commitments are in your relationships with other entities. And Cirecie?
Well,
Or yes.
yes. So I think you talked about the SMART goals before, being able to have goals that are measurable. And so that's important. I'm sure lots of you as leaders have received that kind of training. If not, certainly feel free to reach out to us and we can help you with that. But really, this idea of understanding traumatic stress. So a lot of times we've heard about PTSD. We've heard a lot about trauma. Most recently, people are talking about historical trauma and so on. But we can experience trauma just as folks who are working in communities, in the work that we do in reaching out to disenfranchised communities and working out to minoritized or marginalized communities. We can experience secondary or vicarious stress as a result of doing this work day in, day out. And we can experience burnout, compassion fatigue, and so on. So I would just encourage everybody to really understand and be able to realize that everybody needs to do some trauma prevention in the work that we all do. It's very, very important. So I would say, what can you do right now? I would say reach out to those resources, human resources, to consultants, to colleagues, to sister organizations, and find out how you can get ahead of the curve, prevent your staff from experiencing burnout, try to prevent the impact of all of these modern stressors that are going on. We know that as a result of climate change, that we're going to have more extreme kinds of natural disasters. We know that there are political conflicts, global conflicts that are impacting people and their emotional well-being. And it can, similar to the case that GHA has talked about, it can impede your staff from doing their work, from meeting your mission, your goals. So we really do need to think about what is stressing us out and how can we minimize the impact of that so we can get back to the work at hand.
All right, next slide.
All right.
We're going to need to pick up the pace because we're pretty much out of time. We're providing you with some resources. We talked about that assessment tool that organizations can use to determine whether they're ready to develop partnerships and the quality of partnerships. That's in the chat. I'm going to go to the next slide. We want to give you some reminders. If you're interested in partnering with us, as we mentioned before, you can email us. You can also have a free 30-minute consultation with CREST program. You can access our videos on demand training library of courses that you can access anytime you want. Please complete the post-webinar survey as always. It allows us to know what you liked and didn't like, what topics you'd like us to present on in the future. I think we've covered a lot of questions. We want to cover our Save the Date next month. We'll be covering the history of Black love at CREST program. And that is the information there, and it is available on Eventbrite. GHA has some upcoming opportunities, and I think that is for Bwalya.
Yes, actually, we just have a few but important upcoming events. The first one is actually a training where we are talking about building and maintaining geographically dispersed partnerships, collaborating across an ocean. This will be done in April of 2025. For more details, you need to get in touch. 2025 webinar series, we are also looking at Young Leaders Council information. We are also looking at Global Health Equity Internship Program. And please subscribe to our newsletter and obviously contact list. For more details, I think Michelle is going to present a link in the in the chat so that you can access that which we have announced here. Next.
Yeah, and then you can stay in touch with Global Health Action online. You can go to our website at globalhealthaction.org. You can connect with us on LinkedIn as well as Facebook and Instagram.
And as always, connect with us on social media. Check out our new stuff. Of course, we have a weekly blog, so check that out. We look forward to connecting. That is it. Oh my goodness. Thank you so much for hanging in with us. Our longest webinar yet. And we're so glad to see you still here with us. That's so fantastic. And so with that, you know, when you hear the clarinet, that's either the beginning or the end. Thank you all so much for being with us. You can dance it out to close us out.